Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll discuss angina, one of the most common manifestations of coronary artery disease. We'll review how angina develops, compare stable, unstable, and variant angina, discuss important clinical features of each, and explain why recognizing unstable angina is essential because it represents a form of acute coronary syndrome. Before discussing angina, let's briefly review the cardiovascular disease cascade. In previous lessons, we learned how cardiovascular risk factors damage the endothelium, leading to atherosclerosis and eventually coronary artery disease. As coronary arteries progressively narrow, the heart muscle may no longer receive enough oxygen to meet its metabolic demands. This imbalance between oxygen supply and demand is called myocardial ischemia, and it is the underlying cause of angina. Depending on the severity and cause of the ischemia, patients may develop stable angina, unstable angina, or variant angina. So, what is angina? Angina is chest discomfort caused by myocardial ischemia due to coronary artery narrowing. It occurs when the heart muscle does not receive enough oxygen to meet its metabolic demands. Importantly, angina represents reversible ischemia without permanent cardiac muscle damage. Because angina is a symptom rather than a disease itself, identifying the underlying cause is essential for appropriate management. Let's start with stable angina. Stable angina is the most common type and typically results from a fixed atherosclerotic narrowing of a coronary artery. Symptoms are predictable and occur when the heart's oxygen demand increases, such as during exercise, emotional stress, or climbing stairs. Because the coronary artery can still provide enough blood flow at rest, symptoms improve with rest or nitroglycerin. Importantly, stable angina does not result in permanent myocardial damage. Next is unstable angina. Unstable angina is caused by rupture of an atherosclerotic plaque, with the formation of a partial thrombus that further reduces coronary blood flow. Unlike stable angina, symptoms are unpredictable, often more severe, and may occur at rest. In fact, new onset angina at rest should always be considered unstable until proven otherwise. Although myocardial injury has not yet occurred, unstable angina is a medical emergency because it is a form of acute coronary syndrome and carries a high risk of progressing to myocardial infarction. Lastly, we have variant or Prinzmetal angina, which is different because it is not caused by a fixed atherosclerotic narrowing. Instead, temporary spasm of a coronary artery abruptly reduces blood flow to the myocardium. Episodes typically occur at rest, are relatively brief, and often resolve spontaneously or with nitrates. Common triggers include smoking, emotional stress, cold exposure, and medications that promote vasoconstriction. Calcium channel blockers and nitrates are the primary treatments. Now, for a key point. Both variant angina and unstable angina can occur at rest, so that alone doesn't distinguish them. The key difference is the underlying cause and the clinical presentation. Variant angina results from a temporary coronary artery vasospasm, so episodes are typically brief and often associated with triggers such as smoking, cold exposure, or emotional stress. In contrast, unstable angina results from plaque rupture and partial thrombus formation. Symptoms are new, worsening, or unpredictable and may last longer. Most importantly, unstable angina is considered a form of acute coronary syndrome and requires immediate medical evaluation. That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.